The two numbers that we examine when we evaluate somebody's blood pressure, the first number is called systolic blood pressure, and that is the amount of millimeters of mercury pressure that is inside the artery during a heart contraction. And then the second number is called diastolic blood pressure, and that is when, or that is the pressure in the artery when the heart is relaxed, right? So both of those numbers have very important value when you're assessing how somebody's cardiovascular system is working. There's so many different factors that contribute to why blood pressure may be irregular. But in general, we'd like for a healthy blood pressure is said to be somewhere in the ballpark of 120 systolic over 80. And depending upon age, cardiovascular health, whether or not you're in shape, all of those good things can contribute to whether or not somebody's blood pressure is a little bit lower than those numbers or slightly higher than those numbers. But obviously, you can see there that once you start getting into 130 systolic, 140 systolic, or 90 to 100 diastolic, you're starting to get into an area where there's concern because you can start damaging the blood vessels. Think of it like a water hose, guys. If you leave the water hose out in the sun, you don't roll it up, you don't take care of it, and the sun is beating on it, it gets dry, it gets brittle, it's inflexible, it doesn't have the same pliability, and that makes it more difficult to water your lawn, right? So you have to kink the hose, or you have to do certain things to get the water to project at the same velocity. So that's the same thing that happens with our arteries. They get brittle and age, and they're not as elastic and pliable. So it makes it more challenging to get blood where it needs to go. And, obviously, oxygen and nutrients have to get to the cells in order for them to function. These are the highways and byways that deliver said blood, oxygen, and nutrients. And so when our arteries decline and they're not functional, we run into all sorts of challenges and problems. So, uh, amazing optometrists like Dr. Pitts are going to look at your retina and they're going to say, wow, this looks like these arteries are starting to experience some damage. Let's look at whether or not you have elevated blood pressure levels, etc. So, this is a very important chart just to remember that if you're at the grocery store or if you have a sphygmomanometer, blood pressure cuff at your home, and you're taking your blood pressure, these are the areas where you want to stay. You want to stay in that green to yellow area. If you're starting to get into the orange, red, or the burgundy, this is pretty concerning. So this is where you might need a medicine or you might need some intervention to be able to bring your blood pressure back into what we consider to be a normal range. So I'll just say this one little tidbit before I pass the mic back to Dr. Pitts. There's a multitude. We could have a whole nother hour, 2 hour long conversation about the various different things that can shift your blood pressure. A one-time blood pressure, ladies and gentlemen, is not sufficient to give you a diagnosis of high blood pressure or hypertension. You need to be able to track this over time and also look at all these other factors that may be contributing. Because guess what? Dehydration leads to elevated blood pressure levels. All right. So there's so many different factors. Lack of magnesium, which is one of the key ingredients in our Celergize, can be linked to elevated blood pressure. Diet, exercise, these things are very, very important when it comes to managing your blood pressure. So, when I was in med school, I was doing my rotation with a cardiologist, and I had a very poignant conversation with him about blood pressure. Most of you know that my father passed away prematurely from heart disease. And so this is a topic that's very near and dear to my heart. And so, no pun intended. So the reality is that most doctors are going to assume that you are not going to do the necessary work in your lifestyle, in your diet, in your exercise, in your stress mitigation, etc., to bring your blood pressure down. They're going to start you on a medicine straight out of the gate. And I was very frustrated about that because I'm like, no, this person needs to spend 2, 3 months trying to work on reducing their weight, incorporating some healthier dietary changes and things like that. This cardiologist looked me dead in the face, looked me right in the eyes, and he said, Jeff, if they were going to make the changes, they would have already made them.
Wow.
And that was just such a revelation. I feel like that conversation took place yesterday. So, guys, this is the kind of mindset that you have when you go into your doc. They don't
Mhm.
believe you're going to make these changes. They don't know that you have all of these different um, supplements and strategies and various different things. So that's why our Doc Insights call and a lot of the other conversation around Lifewave is so valuable, so important, because we represent a different type of individual, a different type of patient that really seeks to change things, seeks to find those natural holistic methods to bring our bodies back into balance. So I just wanted to share that. So thanks, Dr. Pitts, for bringing that back around because um, this blood pressure is literally the foundation for our number one killer worldwide is cardiovascular disease. It all starts by abnormal blood pressure.